Australian health officials say the country's well prepared to deal with the arrival of swine flu on our shores. The government says there are adequate stockpiles of antiviral drug Tamiflu, despite questions over how effective the medication is against the strain of influenza.
First SARS, then avian influenza. Health experts say we're now ready for swine flu.
Having had the experience of needing to be prepared for avian influenza, there's been a lot of forward planning, and hopefully if we need to activate those things, they'll come into place pretty rapidly and readily.
Australia has one of the highest stockpile ratios of antiviral drugs Tamiflu and Relenza. And although the drugs weren't specifically designed for swine flu, health experts remain confident they will be resilient.
The early signs are that Tamiflu and Relenza will be effective. Nevertheless, it's important for us to do all we can to make sure the early identification gives us the chance to provide that treatment to people who are at risk of having the disease, even if they are not yet confirmed as having that disease.
The outbreak has proven particularly virulent in Mexico, killing more than 100 people and infecting thousands more. But patients in other countries have presented with milder symptoms, and this has health experts around the world puzzled.
Does that mean it's a different strain that's travelling across Mexico's borders? Does it mean that it doesn't particularly effectively transmit from human to human, which would of course reduce the risk longer term?
The number of countries with suspected or confirmed cases of swine flu is growing, and governments are rushing to develop contingency plans. Swiss drug company Roche Holding AG says it has 3 million packages of anti-flu treatment Tamiflu ready to deliver to any country. Australia is still in the alert phase, closely monitoring the community and raising awareness of symptoms and triggers for the disease.
We would expect that it means that the antiviral drug needs to be used within the first 48 hours of people displaying symptoms. And one of the really beneficial things of an alert like this is that we would hope that people will be treated very quickly.
Airport security has been reinforced to try to catch any potential cases upon arrival. The government says there's no cause for alarm, but says anyone with symptoms should see a health professional immediately. It's also set up a hotline for anyone wanting more information. Nick Humphreys, Sky News.